Dear colleagues, the interlocking themes of the International Year of Health and Care Workers are protect, invest, together. The UN General Assembly just issued a joint statement reinforcing the moral obligation to the health and care workers who have sacrificed their well-being and even their lives so we can continue ours. As we strive to make 2021 a year of transformation, we must listen, evaluate, learn, and turn lessons shared into concrete strategies, actions, and commitments. We must support the health and care workers, who are the foundation of our ambitions to end this pandemic and emerge better prepared for the next, more resilient, and more cohesive. The first two episodes of the Health Workforce and COVID-19 Action Series centered around protection and investment. Our final episode focuses on the links that align and strengthen our promises and actions, togetherness. Multi-sectoral, multi-stakeholder action is at the core of effective policy and management of human resources for health. Whole of society engagement is at the core of emergency preparedness, response, and recovery. The health workforce policy and management in the context of the COVID-19 pandemic response interim guidance prompts policymakers and managers to streamline decision-making processes, explore new partnerships to promote public policies, and strengthen intersectoral collaboration to mobilize the necessary pandemic response. Multisectoral action spans health, labor, education, and finance ministries, and often includes agencies responsible for gender, youth, water, and sanitation and social policy. In addition, COVID-19 response coordination often expanded to include defense, foreign affairs, social security, media, and telecommunications agencies across levels of government, national, subnational, local, and types of employers, public, private, not-for-profit. Today we will hear from professional associations, civil society organizations, governments, and regional alliances about a range of strategies and interventions taken to ensure the readiness, education, and protection of health and care workers. The actions and strategies include mobilizing health and care workers, providing innovative and timely education and training, representing community needs, promoting public health practices, addressing labor rights and decent working conditions, promoting adoption and tailoring of policies and protocols, and much more. Rapid, flexible, and innovative approaches rely not only on leveraging existing mechanisms for political, social, and fiscal dialogue, but also on forging new alliances and improving on existing coordination. The Access to COVID Tools Accelerator Health Systems Connector is one example. Unprecedented investment, research, and development acceleration and innovation in the diagnostic, treatment, and vaccines tools is needed. It must include support for learning, employment, and support for health and care workers so that they are ready to respond to the pandemic and facilitate the rollout of diagnostics, therapeutics, and vaccines. As we all know, vaccines don't deliver themselves. Within WHO, we have greater alignment and synergy than ever amongst our teams at all levels. We are working more closely than ever with funding, implementing, academic, and civil society partners. We see a great potential in the Access to COVID Tools Accelerator to foster a similar alignment among development partners, but it is especially in countries that we advocate coordinated actions by governments and partners in support of the pandemic response. This whole of society approach is essential to propel us through the COVID-19 response and rebuild and fortify health systems and their human capital, health and care workers, against future attacks on our collective health and well-being. Earlier this month, 127 member states adopted a joint statement at the United Nations General Assembly expressing support for the International Year of Health and Care Workers and calling for a global care compact to protect health and care workers. The Global Care Compact will consolidate internationally adopted and recognized principles and recommendations into a single reference document to inform national dialogue, policy, and action for the protection of health and care workers' rights, decent work, and practice environments. Episode 1 brought together global human resources experts to share insights on health and care worker protection through ensuring training and supervision, strengthening infection prevention and control, providing mental health resources, and designing decent work environments. Episode 2 convened UN partners and international financing institutions to urge and support them in designing funding support for sustainable future-looking health workforce investment that has multifold economic, social, equity, jobs, and health returns on investments. In this final episode, which is far from being our final learning opportunity, we appreciate your participation and hope that you will join us in promoting two key objectives of the International Year of Health and Care Workers: engaging governments and all relevant stakeholders in dialogue on the Global Care Compact, and bringing together communities, influencers, political and social support in solidarity, advocacy, and care for health and care workers. We can end this COVID-19 pandemic. We must end this pandemic. We must do this together.